celebrate, and I'm sorry if my words get mixed up, I'm a little frozen, my mouth's frozen. But as we celebrate the birthday of Dr. Martin Luther King Jr., this is a more than appropriate time to discuss justice in healthcare. Would you agree? Yes. Okay. Again, you are our inspiration. Thank you for what you are doing. It does matter. Every little thing matters. Every conversation, every letter, every march that's attended, all those things combine to provide benefit to the larger message. So I'll start by saying, hopefully in these brief moments that I speak to you, I'll leave you with some optimism, like I said. I'm going to tell you briefly about how public health works and how it relates to where we are now. The proposed changes to Obamacare, the Affordable Care Act, will directly impact the services we can and cannot provide to local communities. Representative Janal described many of the items that she's forecasting will be changed, and they likely will be. We still don't know how this will work. I will say to you, and you may not know this, public health and community health has always managed with what we've been given, and we frequently haven't been given enough. We mostly have not been given enough. Anyone who works in these areas of healthcare, and we're the groups that provide care to those with Medicare, Medicaid, those with no insurance, we've always done that. We've always done that, and we're going to continue. I assure you, we're going to continue. Okay? We figure this out because we have to. You all depend on us to make sure you get services that you need, and I want you to continue to do that. You are the reason all of my colleagues and I continue to press forward with less than enough money, less than enough staff, but we keep going. We keep showing up to work every day for you because we're honored to serve. We're honored to serve our communities. Again, sorry, I lost my place here. We're not going to sway regardless of what happens with public policy. This is all, you probably don't know, behind the scenes, this has always been the case. We've always had to figure out how we put this work together with not enough money and not enough staff. Again, we won't leave out our seniors, okay? Our women, our children, our young adults, our LGBT communities, our immigrants, no one, all people, our working families, all of us. This is not an issue that's about race. It's not about political party. This is something we all need. We just have to figure out a way to fund it that works for all of us. Not where we've shifted now to where the wealthiest of us get the most benefit and those who don't have enough suddenly are at a loss. So there's much work to be done, I will say, no matter how you look at this. Again, many people like myself who work in healthcare want a universal healthcare system. Okay? We really could care less, honestly. We have to care because otherwise our doors close. But honestly, when you stand in front of me and you're ill, I'm not wondering about the bill. I really want to find out what's wrong and how can we help. We can't do that without the funding. That's why we need to find a way to fund health care for all of our citizens. Yeah. I know we're far from that, but you know what? Maybe this will push. I know, one thing I know, Colorado is the state to do this. Yeah. Right? We are the state to push this forward. We are role models. We always have been. We passed marijuana. Every time I think about that, I go, you know what? If we can do that, surely in this state, we can figure out how to pass a universal system, even if it's just in our state. Yeah. Okay? Now, granted, again, with that said, I know you're wondering what's happening next. What are the next steps? And I wish, like Representative Janal, that I could tell you, here's what it's going to be, or here's how it's going to work, like I would in a clinical class if I was teaching you. I don't know that, but what I do know is my experience with numerous federal administrations over 30 plus years in healthcare. It takes a long time to implement changes in large public policy. During that time, programs do evolve in the face of implementation. Sometimes legislation is proposed that hasn't been thought through, and it sounds good on paper, but people really don't know the outcome of it, and they usually have to backtrack and say, oh, I didn't realize my Aunt B was going to call me on the phone and scream at me about taking away her Medicare, right? It's these things that people really don't think about. This actually affects all of us, all Americans. So that's one of the first things. The second thing would be healthcare delivery is not done at the federal level, not where the work happens, right? All of these policy changes go through Health and Human Services, they go through the CDC. There's many organizations that have to put their hands on it before it passes down to our state. Again, our state has power about, here's the dollars, what are we going to do with it? We've always had to do that. We'll do it again. This is where we're going to keep our promise to keep our citizens healthy. I don't know how that looks, but I know we're going to continue to work at serving all of our citizens in this state. Okay, yeah. And then lastly, the people who work in healthcare are in our communities. They're like me. They're out, they're your friends, they're your neighbors. Stay involved, get to know them, get to know what's happening. Talk to your care providers. Keep your insurance. All those conversations and strategies are as important as sending letters and marching, but we need to do all of it. So it's very important to stay in this conversation and listen to people who may not think like you, right? Take a minute to find out why they want something to be different. There are many reasons people wanted a change in the ACA, but a change in the ACA is not repealing, right? We can always make things better without throwing out the baby with the bathwater, okay? So I'm gonna encourage you to stay in this conversation. However that looks for you, you can march next week in Denver, go to Washington, okay, right? Go to Washington, go to the Capitol, whatever you need to do. Meet in coffee shops, all those things, they make a difference. The U.S. healthcare system needs lots of work, not only with regard to policy, but we need your help. We do need your help. From the words of Representative John Conyers from Detroit, I don't know if you all know him. Yeah, right? He put together Medicare for All, and he keeps putting it out there, and he won't stop. The guy's 87 years old. He's like amazing. But his thought is you don't give up, because if you give up, you may back out at just the time when the right person is listening, who will shift the tide. So that's why I say it's important to stay in this conversation and keep moving forward. And I'll just say, to wrap up, we go high.